Welcome back to Daybreak. March is Colorectal Cancer Awareness Month. This disease is showing up in younger and younger patients every year. More than 150,000 Americans will get that diagnosis this year. We have Dr. Randall Meisner, a gastroenterologist with Spectrum Health, joining us now. Good morning, doctor. Thank you for joining us. If you can, talk about some of the signs of colon cancer and how this diagnosis is changing over the years here in terms of who's getting it.
Yeah, so I think that one of the problems with colon cancer is that there are not a lot of signs of colorectal cancer, right? Most of the time, people can be asymptomatic. Sometimes they can have bright red blood in the rectum. Sometimes they can have weight loss. Sometimes they can have abdominal pain. But oftentimes, patients don't have a lot of symptoms, and that's why it's so important to get screened early. I think that this is changing because we're finding colorectal cancer over the last several decades at an earlier age, and we're finding it in younger people, and that's why the recommendations have changed to have patients screened before at the age of 45 years old, as you're seeing on your screen, as the standard recommendation. Obviously, that is subject to change. Colorectal cancer screening begins when you meet your physician and you talk about risk factors that may put you at even an earlier age for getting colorectal cancer screening. For instance, if you're having bleeding, if you have a family history of colorectal cancer, if you've had chronic colitis, or if you have any history of a genetic syndrome of colorectal cancer, that may cause you to be screened even earlier than age 45.
If you feel that you want to get a screening, but maybe insurance doesn't cover it, there are some at-home options available now that you can get. How do those work? Is that something that you would recommend as an initial screening before a colonoscopy?
So I'm sorry, there was a little bit of background noise, but I think you asked about at-home screening for colorectal cancer, correct?
Correct, yes.
Yeah, so yes, there are other options to screen for colorectal cancer besides a colonoscopy. So number one, a colonoscopy is going to be your best test for an average risk patient for colorectal cancer screening, and this can be done in patients who are elderly. This can be done in younger patients as well. If a patient can undergo sedation and undergo colonoscopy preparation, that by far and away is the best test for colorectal cancer screening. However, any test is better than no test at all. So there are other options. There are stool tests that people can take at home that can detect blood in the stool or can tell you if you have the genetics for colorectal cancer. There's actually CT scans as well. So we just want patients to get screened for colorectal cancer. Of course, we prefer colonoscopy as the method of screening, but again, any test is better than no test at all.
Okay, Dr. Randall Meisner with Spectrum Health, gastroenterologist, joining us this morning. Thanks for that information. And as a reminder, during Colorectal Cancer Awareness Month, just talk to your doctor about your risk.